All right, let's talk about something most of us have been through but maybe don't fully understand, the X-ray. I mean, how crazy is it that a machine can take a picture that looks right through your skin and muscle to see the bones underneath? Well, today, we're going to pull back the curtain on this incredible medical marvel.
I mean, really think about it. It kind of feels like magic, right? But it's actually just pure, fascinating science. So let's dive in. We're going to break down exactly how this invisible energy creates those black and white images that tell doctors so much about what's going on inside us.
Okay, first things first. Before we can even talk about the picture, we have to understand the invisible light that actually makes it. This is the spark, the moment of creation for the whole process.
So, here's the deal. X-rays are part of the same family as the light you're seeing with your eyes right now. The big difference, they are way, way more energetic. You can think of them like superpowered, invisible bullets of light that can zip right through stuff that normal light just bounces off of.
So where do these superpowered bullets come from? Well, deep inside that big X-ray machine, there's a part that fires a beam of electrons at incredible speeds. They fly through a vacuum and wham! They slam into a special metal target. And it's that massive, energetic collision that unleashes the powerful beam we call an X-ray.
Okay, so we've got our beam. The spark has happened. But how does that turn into a picture of your bones? Well, it all comes down to creating a really, really sophisticated kind of shadow.
Honestly, this is the best way to imagine it. As that X-ray beam passes through you, different parts of your body block it, or don't. The rays that make it all the way through hit a detector on the other side. And here's the key. Dense things, like your bones, they block more of the rays, and that's what creates those light areas on the image. They're casting a stronger shadow.
And these shadows show up in basically 5 shades of gray. You've got air, like what's in your lungs, which barely stops the X-rays at all, so it looks black. Then, all the way on the other end of the spectrum, you have metal, which stops pretty much everything, making it look bright, bright white. And everything else, fat, your muscles, and bone, they all fall somewhere in between. And this picture just says it all, doesn't it? Take a look at the hand. The bones are packed with minerals, so they're dense. They show up as white because they block a lot of those X-rays. But then, look at that nail. That's metal, the densest thing on our chart. And you can see it's just this piercing, brilliant white. It's on a whole other level.
Now, of course, anytime we're talking about X-rays, there's a big elephant in the room we have to address: safety. So let's get right into it and talk about the safeguards that are in place every single time one of these pictures is taken.
This is probably the #1 question on your mind. And you know what? It's a really good one. We all know that radiation can be a scary word, so how can it be used in medicine every single day? Well, it all comes down to a really strict set of rules.
It really boils down to these 3 simple but absolutely critical ideas. First, time. The exposure is kept incredibly short. We're talking fractions of a second. Second, distance. The technicians stay a safe distance from the source. And third, and this is the one you've probably experienced, shielding. That's what those heavy lead aprons are for, to protect every part of your body that isn't being looked at.
And this quote right here, it gets to the heart of why everyone is so careful. There's a core principle in this field that no dose of radiation is considered perfectly safe. Because of that, all radiation is treated with a huge amount of respect to make sure safety is always the top priority.
So at the end of the day, it's always this calculation. A doctor only orders an X-ray when the benefit, what they can learn from that picture to help you, massively outweighs the tiny, tiny risks from the radiation. It's a professional judgment call they make every single time.
Okay, so we've zapped the X-rays, we've created a safe image. Now for my favorite part, the detective work. How in the world does a doctor look at these shadows and figure out exactly what's wrong?
You have to think of a radiologist as a highly trained detective. They're looking at this map of shadows for tiny clues the rest of us would totally miss, subtle changes in size or shape or density. But to do that, they first need a really good map to work with.
And this just shows you how important that is. Look at the image on the left. It's overexposed, basically too dark. Important clues in the lungs could be totally hidden in those shadows. But the image on the right, that's the money shot. It's perfectly clear with great contrast, letting the doctor see everything they need to. Getting this right is absolutely critical.
So when a doctor looks at any specific thing on that film, they're running through a mental checklist, kind of like this one. They're asking themselves, okay, what's its size? Is it bigger or smaller than it should be? What about its shape? Is the outline smooth? Is it in the right position? And does its density, its shade of gray, look normal for that part of the body?
All right, put on your detective hat. Here's our case.
We have an X-ray from a patient who came in with a really sore wrist. Now, if you just glance at it, nothing really jumps out as being broken, does it? But a doctor, they're searching for those subtle clues.
Take a really close look. Zero in on the end of that larger forearm bone, the radius. Do you notice anything a little off? A slight change in its shape, its outline, compared to what you'd expect a normal bone to look like? What story are these shadows trying to tell us?
And there it is. That's the answer. If you look closely, there's a very subtle buckling or wrinkling of the outer layer of the bone. It's not a big, dramatic snap. It's a tiny clue, but it's a definite break. And that slight change in shape and density is the key that solves the whole mystery of the patient's pain.
So there you have it. From a spark of pure energy to a map of shadows, to the final detective work. That is how an X-ray sees inside you. And hopefully, the next time you see one, you won't just see black and white blobs, you'll see a story told in shadows and light. What clues will you look for?